Alright. Hi guys, so this is my presentation for Nursing 442, Case Management of Vulnerable Populations. My presentation today will be on a patient with diabetic ketoacidosis. So my patient's initials, JG. His chronic illness is diabetes. He was admitted to the hospital with a medical diagnosis of diabetic ketoacidosis. As far as his medical treatment, it included an insulin drip, some IV fluids, close monitoring of his blood sugar, and electrolytes. As far as his nursing diagnosis, I chose ineffective self-health management related to his poor blood glucose control. Some interventions included involving family members in the knowledge development of his diabetes, planning for self-management for the patient, and including the family with shared decision-making. So my patient, Mr. G, he's 65 years old. He's a Hispanic male. He currently works part-time as a cook at a local restaurant. He enjoys playing soccer and cooking on his days off. And he's married. He lives with his wife and one of his married daughters. He's got 2 grandchildren, a 5-year-old grandson and a 7-year-old granddaughter, which he also lives with. And he also has a son whom he does not live with. So on his days off, he likes to pick up his grandchildren from school and helps babysit them for a couple hours. So they live in a 3-bedroom condo. His wife is retired and is able to contribute minimally financially. The family is lower middle class and the patient has medical insurance. So his daughter was the one who brought him into the hospital because he was having symptoms of diabetic ketoacidosis, which included he was getting a little altered, had some altered mental status. His blood sugar was greater than 300. He started to have fruity odor on his breath, frequent urination, some nausea, vomiting, and he's dehydrated. Let's see, and he's been diagnosed with diabetes mellitus type 1 since childhood, and he's recently had multiple admissions related to his poor blood glucose control, mostly hyperglycemia. So self-care and self-management capacity. So Mr. G is pretty independent. He can care for himself with little assistance. He just needs frequent reminders to help him control his diabetes. He's able to test his blood glucose. He understands why insulin is being prescribed. Just some of the things that he does need help with. He needs help with following a strict diet and exercising a little bit more since he is overweight. So he's recently had trouble maintaining his blood glucose levels because he's not following a strict diet, and he's also not exercising very much on a regular basis. So in order for him to properly manage his diabetes, he must be able to test his blood sugar, understand why insulin is being prescribed. He must know the doses and frequency of insulin and be able to discuss the relationship between meal times and action of the insulin, which he does know. He also should know how to prepare and administer insulin properly and how to store it. He should also be able to list symptoms of hypo and hyperglycemia and how to properly manage those both. He does know the symptoms, however, he fails to properly manage them. He should also be able to tell what kind of dietary changes are needed during an illness, and he should be able to verbalize when to call the doctor or the nurse, um, such as frequent episodes of hyper or hypoglycemia. And like I said, he should be able to follow a strict diet and the importance of it, which he's not doing. And he's also not calling the doctor when he is testing his blood sugars and they seem very high. Um, but like I said, he's pretty independent. He's able to do his activities of daily living independently. It's mostly just frequent reminders and a little bit more education that he needs to properly manage his diabetes. Priority patient issues for discharge planning. So he lacks education in managing his diabetes. I feel like he needs more family support. He does have family. I know they're pretty busy with their own lives, but they should have a little bit more time um, to help him out, to help prevent him from being hospitalized again from his poor glucose control. And he also would benefit from community resources. And some of the community resources that would probably be helpful for him would be like a cooking class, a healthy cooking class, and maybe an exercise class to help manage his diabetes, or finding a diabetes support group. So discharge destination, so the case manager would determine that he would be a candidate to go home with home health. Um, like I said, he's independent. He just needs a little bit more education. And I feel like follow up appointments with home health visits, providing a little bit more education and review of skills would be a benefit to him. So the case manager would coordinate his home health care, work with his insurance company, in this case being Medi-Cal, and set up his home health. So priority patient level and system level nursing case management strategies. So the patient level strategy would be his education, and the system level strategy would be managed care, such as planning, coordinating, and providing resource management. So intervention for patient level nursing case management strategy. The case manager should coach the patient symptom self-management, and coach caregiving for the family. So education is a big issue for him. But the case management would provide some more education on how to manage his diabetes, help coach the family, educate the family as well about how to help him properly manage his diabetes. So the case manager should educate the patient on following a strict diet, um, being involved in a little bit more physical activity, and possibly, trying to lose some weight since he is overweight. So intervention for the system level nurse case management strategy. The case manager would coordinate home health care, provide the patient with follow-up resources. So yeah, like I said, the case management strategies at the system level, the case manager would help planning, coordinating, and providing resource management. Utilization review. So, utilization review is a process in which medical review determinants are made based on clinical guidelines and structured processes. They use established criteria to evaluate the medical services for necessity, the level of care, appropriateness of the patient, quality, and timeliness of discharge. So, in this patient's case, the utilization review was very effective. He was admitted to the hospital as an inpatient due to his diabetic ketoacidosis. His level of care was appropriate, and he received high quality of care during his hospital stay. And he was discharged home with home health in a timely manner. Quality and safety. So some quality indicators are measurable, specific, and clear guidelines. They're used to monitor and evaluate certain aspects of patient care. So all this ongoing monitoring should start to show trends and opportunities to improve patient care. So case managers play a very important role in providing quality of care for patients. And usually, if they exercise their patient and family advocacy, a role, assume responsibility, accountability for ensuring patient safety, quality of care, and satisfaction, safe and effective care is, for the most part, guaranteed. Nursing case management effectiveness at the system level. For this patient, it was pretty effective. He benefited from his home health care services that were provided. He gained more education and support to help effectively manage his diabetes. The home health nurse encouraged him and helped him treat his episodes of hyperglycemia. And then he was eventually able to do that on his own once the home health care visits were complete. So, nursing case management effectiveness at the patient level. So, the case manager was very effective in providing more education for this patient regarding controlling his diabetes, monitoring his blood sugars, providing education on how important it is to follow a strict diet, to include some more physical activity, and possibly trying to lose some weight, which would all help in managing his diabetes and maintaining his blood glucose levels at target goal. So that completes my presentation. Thank you.